Good afternoon. As a land-grant institution, we would first like to acknowledge the Gabrielino Tongva peoples as the traditional land caretakers of Tovangar, that is, the Los Angeles Basin and South Channel Islands. My name is Inez Ponce, and I'm the director of the UCLA Center for Health Policy Research and professor and chair of the Department of Health Policy and Management at the Fielding School of Public Health at UCLA. Welcome to today's webinar, Coping with COVID, the Mental Health Consequences of the Pandemic's Economic and Social Crises. When the COVID-19 stay-at-home orders forced businesses, childcare centers, and schools to close or operate online, only millions and millions of Californians lost critical sources of income and childcare. But what kind of impact did it have on mental health? A study by the UCLA Center for Health Policy Research found that Californians who face these types of financial and childcare difficulties due to COVID-19 experience an increase in household conflict during the statewide stay-at-home orders. Using data from the California Health Interview Survey, today my colleague, Dr. Imelda Padilla-Frausto, will discuss the correlation between economic hardship, household conflict, and mental health outcomes during the pandemic. The findings we're presenting today suggest that state policymakers must continue to address the mental health impact of the pandemic by removing barriers to mental health care in California. Next slide, please. If you're interested in today's slides, you can request them from our communications department at healthpolicy@ucla.edu. I'd also like to take a moment to let you know about an upcoming event. Next slide, please. On Wednesday, March 22nd, our Native Hawaiian and Pacific Islander Data Policy Lab will unveil several exciting new data dashboards and community-centered data tools, including California, county level, and US state level social determinants of health dashboards. We'll post a link in chat for those who are interested in attending on March 22nd. So now, let's begin today's discussion, and I'd like to welcome Dr. Imelda Padilla-Frausto.
Thank you, Dr. Ponce, for the introduction. I want to thank everyone who is joining us today. I really appreciate you and your time to be here. Before I begin, I would like to thank the California Department of Healthcare Services, the Community Health Service Division, for funding the mental health questions in CHIS and the policy briefs released on this topic. I also want to thank my co-authors, Nicole Berriera, Adam Aldiva, and Hillary Wright. I also want to thank the amazing staff in the Communications Department, the Data Access Center, the Statistical Unit, Admin and IT support, and all the CHIS staff. Well, basically the entire center family. Last but not least, I want to express deep gratitude to all the individuals who responded to the 2020 and 2021 surveys during such difficult times. The analysis, interpretation of the data, conclusions, and views presented today do not necessarily represent the UCLA Center for Health Policy Research, the Regents of the University of California, or collaborating organizations or funders. I do want to share that I will be discussing suicidal ideation, a sensitive and potentially triggering topic, towards the end of my presentation. If you or a loved one are experiencing distress or need crisis support, please call or text 988. For today's presentation, I'll be going over the background, research questions, and methods we used. I'll be sharing some key highlights from the results of our study, and I'll conclude with some policy implications before we go into Q&A in the last 15 minutes of the hour. As we know, in early March of 2020, shortly after the World Health Organization declared COVID-19 a pandemic, California became the first state to have shelter-in-place orders. By mid-March, Dr. Ponce and the dedicated staff of CHIS took immediate action to include a new module in CHIS. This module would capture many aspects of the experiences and challenges brought on by this pandemic. While these orders were meant to safeguard people's physical health, they would not necessarily safeguard the livelihoods or financial well-being of many. These are two important factors associated with mental health, as we saw during the Great Recession of 2008. According to 2020 CHIS data, nearly 3 million adults in California lost their job because of COVID. An additional 5 million adults had their work hours or income reduced. Furthermore, 1.12 million adults had difficulty paying for basic necessities. An additional 1 million had difficulty paying for their rent or mortgage. And another 1.5 million had difficulty paying for both. Additionally, 500,000 adults had difficulty finding or paying for childcare. Another important factor related to both financial and mental well-being is domestic violence. Even though CHIS did not ask specifically about domestic violence, it did include questions about increase in interpersonal household conflict during the stay-at-home orders. Nearly 4 million adults in 2020 said they did experience an increase in interpersonal household conflict. In the first part of today's presentation, I am aiming to answer the following questions. Were there group differences in job loss or financial difficulties due to the pandemic? Were there differences in mental health outcomes by these hardships? Were there group differences in interpersonal conflict during the stay-at-home orders? And were there differences in mental health outcomes by increases in conflict? For today's presentation, we'll be looking at data from both 2020 and 2021 CHIS. CHIS is the largest statewide health survey, and it captures a representative random sample of adults in every county. CHIS is designed with complex survey methods, which require survey weights to be used in population level analysis. I do need to note that one of the main limitations of using CHIS to identify the mental health consequences of the pandemic is that it is a household survey, and therefore it does not capture the experiences of individuals who were unhoused, institutionalized, or incarcerated. One of the mental health outcomes we will look at today is psychological distress. To measure it, CHIS uses the Kessler-6, a 6-item instrument asking respondents, how often do you feel nervous, hopeless, restless or fidgety, depressed that nothing could cheer you up, that everything was an effort, and how often did you feel worthless? Responses to these questions include all of the time with a score of 4, most of the time with a score of 3, some of the time with a score of 2, a little of the time with a score of 1, and none of the time with a score of 0. These scores from all 6 responses are summed, resulting in a total score ranging from 0 to 24. If scores were between 9 and 12, we identify individuals as having moderate psychological distress, which has been validated to be clinically relevant. For a score of 13 or higher, we identify individuals as having serious psychological distress. This is a clinically validated measure designed to estimate the prevalence of diagnosable mental disorders within a population. Another mental health outcome that is often used in clinical settings is functional impairment. Specifically, we looked at severe impairment. as this is often the criteria used to determine if individuals are eligible for specialty mental health services. To measure functional impairment, CHIS uses the Sheehan Disability Scale. And due to predetermined skip patterns in CHIS, these questions are only asked of adults who score 9 or higher or 6. The questions ask individuals to think about the month in the past 12 months when they were at their worst emotion. And then they are asked if their emotions interfere with their performance at work or school, their ability to do household chores, with their social life, and with their relationships with friends or family. Individuals can respond a lot, some, or not at all. For those responding a lot, we classify them as having severe impairment. From the CHIS COVID-19 module, we looked at the financial impact due to COVID, which included questions about difficulties paying for basic necessities, rent or mortgage. We also include difficulty paying for or finding childcare, given that schools and childcare centers had also closed during the stay-at-home orders, and for parents who had to switch to working from home or who were continuing to work as essential workers. The lack of childcare or having their children in school while they work may also be a source of stress related to the financial well-being of families. We looked at the impact on employment and separated these out into those who lost their jobs or had their hours or income reduced for employment impacts, and then a separate impact on work for those who had to switch to working from home or continue to work as essential workers. The last indicator from the COVID-19 module we looked at is the increase in interpersonal household conflict during the COVID stay-at-home orders. This included increases in physical punishment, snapping or yelling, or interpersonal conflict. These questions were asked of adults in households with 2 or more adults, or single adults with children or teenagers in the household. There were 2 policy briefs on these topics. One was released in November of 2022, and the other in January of this year. These policy briefs can be accessed online, as well as the infographics I'll be sharing today. I believe Tiffany is adding these links into the chat. Today, I'll be providing some of the key findings from these policy briefs, but today's presentation will mostly be providing some new data and expanding on the findings from these policy briefs. To answer the first question, were there group differences in job loss or financial difficulties due to the pandemic? We found that Latinx adults were more likely to have lost their jobs compared to non-Latinx white adults. That is 15% of Latinx adults compared to 11% of white adults. However, when we looked at financial difficulties, we found that Black adults were more than 3 times as likely to have difficulty paying for their rent or mortgage compared to white adults. That is 16% of Black adults compared to 5% of white adults. Similarly, Black adults were more than twice as likely to have difficulty paying for basic necessities compared to white adults. That is 15% of Black adults compared to 6% of white adults. And not surprisingly, adults with incomes less than 100% of the federal poverty level, or FPL, they were nearly 4 times more likely than adults with incomes greater than or equal to 300% of the FPL to have difficulties with paying for basic necessities. That is 18% of adults with income less than 100% of the FPL, compared to only 5% of adults with incomes greater than or equal to 300% of the FPL. In the next 2 slides, we answer the question, were there differences in mental health outcomes by these hardships? If we only look at the mental health of adults in 2020 on the left side of the screen, we see that 23% of adults had serious or moderate psychological distress. However, when we look at the mental health of adults who experience job loss or financial difficulties, we see on the right side of the screen, the percentage of adults with serious or moderate psychological distress goes up to 34% for adults who lost their job due to the pandemic, 38% for adults who had difficulty paying for their housing, 39% among adults who had difficulty finding or paying for childcare, and 41% among adults who had difficulty paying for basic necessities. For the second mental health outcome, severe functional impairment, we did the same comparisons. Looking at severe impairment for all adults with serious or moderate psychological distress, these are the top percentages in this table. We see that more than 1 in 3, or 34% of adults with serious or moderate psychological distress were severely impaired in their personal relationships and with household chores. And more than 2 in 5, or 42% of similar adults were impaired in their social lives. And 1 in 3, or 30% of similar adults were severely impaired in their performance at work or school. Then we compared these percentages with the percentage of similar adults who lost their job or had financial difficulties. The policy brief has these percentages for all economic stressors. But here in the second row of the table, we provide the percentage of severe impairment for adults who had childcare difficulties. More than 1 in 2 of similar adults with childcare difficulties had severe impairment in their personal relationships, with household chores, and in their social lives. More than 2 in 5, or 42% of similar adults were severely impaired with their work or school performance. In the next 3 slides, we aim to answer the question, were there group differences experiencing any increase in interpersonal conflict during stay-at-home orders? On the left-hand side, we see multiracial adults were nearly twice as likely as Black or Asian adults to experience increases in interpersonal conflict. That is 31% for multiracial adults, compared to 17% for Asian and 16% for Black adults. By citizenship status on the right side, we see US-born adults were more than 1.5 times as likely as naturalized or non-citizen adults to experience increase in interpersonal conflict. That is 25% compared to 16% and 15% respectively. By sexual orientation on the left side, we see 44% of bisexual adults who experienced increase in interpersonal conflict. This was 2 times more than straight or heterosexual adults at 21%. And more than 1/3, or 33% of gay, lesbian, and homosexual adults experienced an increase in interpersonal conflict. By age group on the right side, we see that more than 1 in 5, or 20% of young adults ages 18 to 24 experienced any increase in interpersonal conflict, and they were more likely than any other age group to have this experience. On the left side here, we see women were more likely than men to experience any increase in interpersonal conflict. That is 24% of women compared to 20% of men. By family type on the right side, we see 1/4, or 25% of single adults with or without children experience increases in interpersonal conflict. 24% of married adults with children and 16% of married adults without children. In these next 2 slides, we aim to answer the question, were there group differences in mental health outcomes due to increases in conflict? For all adults, in the 2 bars on the left side of the vertical line, adults who experienced an increase in interpersonal conflict were more than twice as likely to have serious or moderate psychological distress compared to adults who did not experience an increase in conflict. That is 43% shown in the blue bar compared to 19% shown in the yellow bar. We examined this relationship by sexual orientation, seen in the 4 bars on the right side of the vertical line. And we see a similar trend with adults who experienced any increase in conflict, shown in the blue bars, being more likely to have serious or moderate psychological distress in both groups. But the percentage was much higher for adults who identify as gay, lesbian, homosexual, or bisexual. The group with the largest percentage of having serious or moderate psychological distress was found among adults who identify as gay, lesbian, homosexual, or bisexual, and who experienced an increase in conflict, 68% shown in the leftmost blue bar on the right. This group was nearly 6 times more likely to have serious or moderate psychological distress, compared to 17% of adults identifying as straight or heterosexual who did not experience any increase in conflict, shown in the rightmost yellow bar. Interestingly, gay, lesbian, homosexual, or bisexual adults who did not experience any increase in conflict had the same percentage of serious or moderate psychological distress as straight or heterosexual adults who did experience an increase in conflict. This is shown in the yellow bar, 41% compared to 40% in the blue bar in the middle. We also examined this relationship by age group and found a similar trend. In each age group, adults who experienced an increase in conflict were more likely to have serious or moderate psychological distress than their counterparts that did not experience any increase in conflict. In the leftmost blue bar on the right side of the vertical line, we see 68% of young adults ages 18 to 24 who experienced any increase in conflict have serious or moderate psychological distress. These young adults have the highest percentage than any other age group, regardless of conflict. In these next 2 slides, we take a look at the intersection of financial difficulties and conflict and the impact these have on mental health outcomes. In this slide, we are looking at serious psychological distress in the blue bars and moderate psychological distress in the yellow bars, by increases in conflict and by financial impact due to COVID. On the left-hand side, we see in the leftmost blue bar, 38% of adults who were financially impacted due to COVID and who experienced any increase in conflict had serious psychological distress. This is more than double the percentage of adults who were also financially impacted, but who did not experience any increase in conflict. That is 16% in the left middle blue bar. Among adults who were not financially impacted, now looking at the bars on the right-hand side, but who did experience an increase in conflict, 22% had serious psychological distress, seen in the second middle blue bar. The group with the lowest percentage of serious psychological distress, 8%, is seen in the rightmost blue bar. This is among adults who were not financially impacted and who did not experience any increase in conflict. Similar trends were seen in the percentage with moderate psychological distress in the yellow bars. The highest percentage, 21% in the leftmost yellow bar, among adults who were financially impacted and who experienced any increase in conflict, compared to 10% of adults in the rightmost yellow bar who did not experience either of these hardships. In this slide, we looked at severe impairment in one or more life domains among adults with serious or moderate psychological distress and see somewhat similar trends in the data. 75% of adults who were financially impacted and who experienced any increase in conflict had severe impairment, the highest percentage of severe impairment compared to all other groups. However, The percentage of severe impairment is still really high in all of these other groups, with more than 1/2 having severe impairment, regardless of financial impact or increase in conflict. In this slide, we are looking at trends in serious psychological distress by financial difficulties due to COVID, comparing 2021 data in the blue bars to 2021 data in the yellow bars. For all adults, we see this percentage go up from 12% in 2020 to 17% in 2021, a statistically significant increase. Among adults who had difficulty paying for rent or mortgage, 24% had serious psychological distress in 2020. We see another statistically significant increase in 2021 with 33%. The same trend was seen among adults who had difficulty paying for basic necessities, 26% in 2020 to 37% in 2021. The increase from 23 to 28% among adults who had difficulty with childcare was not statistically significant. In the next 4 slides, we look at the percentage of adults who thought about suicide in the past 2 months. Again, I'd like to share the new hotline number 988 to talk to someone and get support if you or a loved one are experiencing distress or need crisis support. Here we see among adults who have been financially impacted due to COVID, nearly half, or 46%, had thoughts about suicide in the past 2 months. More than 2 out of 5 adults whose employment or work was impacted due to COVID thought about suicide. In the next 3 slides, we look at group differences in suicidal thoughts among adults who were financially impacted due to COVID. In this slide, we see suicidal ideation was high in both men and who were financially impacted, but higher for men with 57% compared to women at 38%. By family type, comparing married adults with or without children on the left and comparing single adults with or without children on the right, we see within each group thoughts of suicide in the past 2 months was significantly higher among financially impacted adults without children. We see 54% among married adults and 50% among single adults. By age group, we see more than half, or 56%, of older adults aged 65 and over who were impacted financially due to COVID thought about suicide in the past 2 months, as did similar adults ages 25 to 39 with 55%. As we wrap up today's presentation, I'd like to close with some policy implications. I hesitated to include increasing access to mental health services to this list. While I do think and believe this is an important policy implication, our current mental health care system cannot by itself handle the influx of services and supports that are needed. Prior to the pandemic, there was a shortage of mental health professionals in just about every part of the state. California policymakers must address the economic and social crises of the mental health crisis we are now facing. While there have been several studies that looked at how the stimulus payments and unemployment benefits kept many out of poverty, we have to ask, was this enough? In high-cost states like California, so many individuals and families were already struggling to make ends meet before the pandemic, and their financial struggles were only exacerbated by the pandemic. As an example, many who lost their jobs fell behind on making rent or mortgage payments. Yes, moratoriums on evictions and foreclosures kept many housed, but once those protections went away, how do these folks catch up on those payments? How long would it take? Will they ever catch up? Yes, some qualified for rent or mortgage relief, but many did not. California policymakers need to need adequate tools to measure economic security. Tools like the Insight Family Self-Sufficiency Standard, or United Wage Real Cost Measure, or the California Elder Index for older adults. All of these tools document the actual income needed to cover very basic living expenses for housing, healthcare, food, childcare, transportation, and taxes. Several studies have found that the minimum income needed to cover these very basic living expenses in California is on average about 2 times the federal poverty level guidelines. Basic needs for housing, food, and healthcare can be addressed by increasing the supply of affordable housing, continuing to expand the eligibility criteria, increasing benefits. These could all help to reduce the mental distress related to economic insecurity. And lastly, but not least, addressing longstanding inequities and supporting families and social healing could help to reduce or prevent the harmful effects of conflict. Thank you for joining us. This is my contact information. Please feel free to reach out, follow me on Twitter. I look forward to hearing from you. And now I will turn this over as soon as I can to Tiffany Lopes, who will guide us in the Q&A.
Thank you so much. And thank you, Dr. Padilla-Frausto, for that really important and enlightening presentation. We're going to be going through the audience questions right now, so I encourage you to use the Q&A function in Zoom. Let's get to the first question. Going back to slides 21, 22, and 23, somebody asked, when you say physical punishment, does that mean physical punishment of children?
That's a very good question. This was asked of adults, so they were responding to any physical punishment in the household, which I imagine would include children.
Thank you. Access to affordable, high-quality childcare was a problem before COVID, but the pandemic has exacerbated the problem, and those issues have persisted. Considering these findings showing a relationship with mental health, has the California Health Interview Survey continued to ask similar questions about childcare access?
That's a really good question. I believe we do have some questions on CHIS that look at whether or not people are using childcare and how much they're paying. Don't quote me, email me, I'll get back to you. But yeah, I do believe there are some questions, and it is important. The pandemic really gutted the childcare, a lot of family childcare programs, and we're seeing the ramifications of that. Thank you for asking that.
Do you have preliminary 2022 data on serious psychological distress? And if so, has it remained elevated?
2022 CHIS data will not be released until later this year in October. So we will continue to monitor this. It's a very good question.
Yeah, if you sign up for our listserv, Christina, we will email you when that event is going to happen. We release findings. As you do grouping by sexual preference, can you also break down analysis by monogamous versus polyamorous?
That one I'm not sure. I'd have to get back to you on that one.
Okay. Someone says, apologies if I missed it, but was 2018-2019 data on suicidal ideation compared with 2020 and 2021?
We have not looked at that yet, but that is a very good suggestion, just to see what that looks like baseline in previous years and seeing how that compares. Very good question. Thank you.
And can you talk about suicidal ideation? Is this serious consideration of suicide?
So this is asking about whether or not people had thoughts about suicide. There is a second question that is usually asked when calling a suicide hotline that ask about plans, and we do not have that information.
Similarly, I think sometimes folks get confused with some of the language that we use. What's the difference between serious psychological distress and moderate psychological distress?
So in clinical settings, especially for like specialty mental health services, you have to be experiencing mental health problems that are serious enough to impair you in your day-to-day living, and that is looked at in terms of like who is eligible for specialty mental health services. But within CHIS, we have the Kessler-6 has been used looking at that score of 13 or higher as a way to not predict, but to estimate the prevalence of mental health disorders, diagnosable mental health disorders in a population setting. And so they validated this measure in a clinical setting, looked at people who had a diagnosable disorder, asked them these questions, and then looked at whether or not those two related. And they found that a score of 13 or higher is like a good cutoff to get at having a diagnosable disorder. The moderate psychological distress, which is a lower score on the Kessler-6, has been validated also in a clinical setting to look at whether or not people scoring moderate were also benefiting or using services, and this was found to be true. And so thinking about psychological distress, it's on this continuum. It goes, if you think about it, it's scored from 0 to 24. And if you're at a certain level for more than 2 weeks, this can be really important, and letting doctors know or people you talk to know, because that could indicate, a possible diagnosable disorder. And so those are some cutoffs that we use. In terms of what does it really mean, to me it means whether or not you get certain kinds of services, is how we sort of distinguish it in what we're looking at. But in general, I would say anybody with moderate or serious psychological distress should be receiving some sort of counseling or services, or dealing with the social and economic issues going on in their life. So thank you for asking that.
Has your team done anything to look at mental health burden among adolescents during and since the pandemic?
We have not looked at that yet. We will be looking into it. And so that is another, the possible webinar maybe.
Sounds like one. Somebody also had another comment saying, I'd love to see data on how the pandemic has affected the mental health of immunocompromised and other people with high-risk health issues. So it sounds like there's a lot of demand for more
Yes.
data. And
yes, and a lot of this data, I just want to say, is in the PUF files, the public use files. And, there's just so much to explore, as you can tell from, this, all the data in my slides. Like, there's just so much to unpack here. And so anybody who is interested in doing research, please, reach out, because they're just did a really great job in responding quickly to the pandemic and capturing a lot of what was happening in real time in people's lives. And there's a lot of great data in the COVID module in GIS.
I was just going to say too, we often forget to mention this in webinars, but all of this data is free and accessible to the public on our Ask GIS website. So if you are interested in exploring the data, we definitely encourage you to sign up for that free account. You could look at mental health among adolescents and whatever else you're interested in doing very easily. We also have tutorials available online to show you how to do it. It takes just a couple minutes to sign up for an account. So definitely encourage you to do that. And, let us know if you have questions. You can always email the healthpolicy@ucla.edu account as well. And we'll connect you to the right folks. We've got a couple more questions. So in addition to short-term mental health burden, there is evidence tying experiences such as food insecurity and housing instability to long-term mental and physical health consequences. Does your team intend to follow these issues in the long term, or is this a pandemic era focus only?
Yeah, that's a really great question, and very important issues. And you're absolutely right. Our data is cross-sectional, and so we don't follow people over time. So we can't really look at that in those sort of terms, but we do have new questions either this year or next year on looking at housing insecurity. We already have questions on food insecurity. The only thing we can't capture is whether or not people have been dealing with this issue for a long period of time. And so you're absolutely right. When people are faced with these difficulties and they are experiencing it for long periods of time, it can lead to mental disorders, and definitely, exacerbate any existing ones. And so again, if you're interested in this, and Tiffany made a really great point about exploring the data on AskGIS. It's a really great tool. You can look at these data by year, look at trends across years when there's, the data is collected across years. And so, I think it's something that we will continue to monitor as much as we can within the methods we have. I think it will be an ongoing important issue. As we know from the economic recession from 2008, I think people were barely coming out of that, and then we got hit with the pandemic. And so there's a lot of questions to explore on these impacts, these economic and social impacts on mental health. So thank you for your question.
And also just since you mentioned housing instability, I do want to say we have a policy brief coming out on housing instability, housing issues during COVID, and access to healthcare, whether folks delayed or cut back on healthcare. That will be coming out in 2 weeks. So if you sign up for our listserv, if you email us, you will get that publication in your inbox and learn more about that. So I feel like it's like my fourth plug for email us and sign up for our listserv, but do it, right?
Yes, do it. It's a lot of wonderful data that I'm a little biased, but we do a lot of great work here.
Yeah, I agree. Somebody asked, what resources should I presently give to potential individual asking for help regarding the mental health consequences of the pandemic's economic and social crisis?
That's a really, really great question. I'm not sure in what capacity this person's asking about in terms of resources, but I think California, you know, is kind of leading the nation and being able to ensure that more people are have healthcare coverage, more people are able to get are eligible and able to get food supports through the SNAP program. I think plugging people into social supports services, I think, is really important, because this mental health crisis cannot be solved solely by sending people to mental health services when they're struggling to make ends meet day to day or at risk of losing their home. I think seeing a therapist is important, but when you're about to lose your home, that's kind of the last thing you want to do. You definitely need some financial supports, and so whatever programs are out there, if you know of anybody looking to put money into some programs, I think programs, private and public investments, and addressing the social and economic needs of people in California right now is a high priority, and will help everyone overall, including reducing the burden on the mental health care system.
Has there been a study on psychological impact of going back to normal, in quotes, such as workers forced to go back to work, ending mask requirements in healthcare setups, and the Biden administration ending the emergency declaration?
That's a really great question. And as far as I know, I've not seen anything. So if anybody knows of anything, please share, because that would be really great to know.
Yeah, feel free to drop any in the chat. So the next question, either you can answer it or I can answer it. Are there any considerations at your center of the role that climate change, for example, recent floods and wildfires, could have in exacerbating housing instability or other forms of adverse experiences in California, and thus health burden?
Yeah. Why don't you take that one, Tiffany?
I was just going to say that we do have a module in CHIS on climate change and mental health. It is in the 2021 CHIS and will also be in the 2022 as one of the questionnaire topics. So definitely check that out on Ask CHIS. And I'm not aware of any potential publications. Are you?
I'm not aware of any.
Okay. But definitely a really important question and something that we
Very
have
much
gotten
so.
funding for.
Yep.
So thank you for asking about that. I think I have one more question. So if anybody else has any questions, please feel free to drop them in the chat or using the Q&A function in Zoom, either or is fine. In one of the slides, I believe it was slide 29, it showed that nearly half of adults who experienced COVID-related financial impacts had serious thoughts of suicide. How can we get this information out to more people? We've got some great policy briefs with this data. What would you say to folks who are interested in sharing this, how to share it, where to share it?
That's a really great question. I'm trying to think, because on Ask CHIS, I don't think we have that particular question available on Ask CHIS. Yeah, I mean, I think if there's a need for it, definitely reach out to me. I'll look to see if we can't put together maybe a fact sheet or something, but I agree. And we just barely started exploring that data because we needed 2 years of data to have stable estimates. And so that's definitely something we're going to be exploring further. If there's anyone interested in funding a policy brief, please let us know. because I think that would be another great policy brief for people, for us to develop and for people to have, to use, and to advocate for helping folks.
Another question on another behavioral health issue. Did the CHIS ask any pandemic era questions about substance use? So alcohol, opioids, etc. And I think we can say there is data or on those topics in the 2020 and 2021 CHIS that you can explore. I don't know that there's actual data on the impact of COVID on these things, but there is data for that time period.
Yeah.
And then what's next for you? What's your next publication on mental health that we will be looking forward to?
So the next couple of policy briefs that we're doing is we're actually going to take a deeper dive into looking at the mental health of Black adults and adolescents in California. We're also going to take a deeper dive in looking at the mental health of our immigrant population. And so those will be, those are two policy briefs that will be coming out this year. And then later on, we'll also be looking at housing insecurity and adverse childhood experiences, but those won't be till the following year. So
Colin in the chat, if you're not following us on social media or signed up for our listserv, please do that because we've got a lot of great content coming to you soon.
yes.
Those are all the questions that we have. I just want to thank everybody again for attending this month's webinar on COVID and mental health. We will be posting the recording online with closed captions in the next couple of weeks. You can visit our YouTube channel or go to healthpolicy.ucla.edu/seminars. If you'd like a copy of today's presentation, we can send you a PDF. So just email us at healthpolicy@ucla.edu. And I think that's it. Have a wonderful rest of the day.
Thank you, everyone.
Thank you.